guys, this is Tyler with Southern California EMS Training Institute. Today we're going to be talking about advanced airways and how an EMT can assist a paramedic in maybe setting up an advanced airway and some of the different names of the different equipment and other things you might find on an ALS or advanced life support rig. So let's go ahead and take a look. First off, we have several different types of advanced airways down here. Now, we have what we call supraglottic airways, and supraglottic airways are going to include at least these three right here. So we see this one's known as an LMA. These three right here, you can see there's different colors and different sizes, are known as king tubes or king airways. And this one right here is a combi tube. They're all known as supraglottic airways because they actually go and are inserted above the glottis, and that means they're above the patient's epiglottis and actually inserted almost into the esophagus. Now these are definitely great airways. They're better than an OPA, but the best airway we actually have, again, this is the best airway that we have. This is known as an ET tube or an endotracheal tube. This actually gets inserted directly into the trachea, so it's able to give air directly to the patient's lungs. The one nice thing about it too is you see a lot of them actually have these little balloons on the edge, so they can actually isolate the trachea, meaning if the patient were to vomit or some sort of fluids were to be in the airway, it would keep those fluids from going down into the patient's lungs. So those are our different airways that you guys can see. Again, just to go over the names of them, we have our LMA, our King Airways, our Combi tube, and then our ET tubes, and all of them can be used in an advanced life support situation. Now, some of our other equipment that you guys should be familiar with. Now, first off, coming up here, we actually have probably the most important equipment during this whole, procedure is actually what we call capnography. Now, we have capnography and capnometry, but capnography is able to actually measure a patient's exhaled CO2. This is probably the most vital piece of equipment because it lets us know that these other airways that we just talked about are actually working and are being used for the patient correctly. So as the EMT, this is probably the most important step for you guys. If a paramedic asks, hey, can you grab me capnography, that you're going to want to go ahead and select one of these devices. Now, determining on what you're doing, if you're intubating, most commonly we're using this one. This one is actually a capnography, but it's for a patient who's awake, and you actually hook it up. It's like a nasal cannula, super useful. But in a situation where we need to do an advanced airway, this patient will not be awake. This is colorimetric capnometry. Again, it's more commonly found in the hospital setting, but again, might be found on your rig as well. So it's good to know what equipment that you guys utilize. Coming over here, we have things like our tube tamer, right? This is a way to actually secure an airway in the patient's mouth to keep it from maybe getting removed, getting pulled out, or even from that airway moving itself. Because we don't want that airway to become dislodged and then maybe we don't notice it. So it's really important that we keep that airway nice and secure. This strange looking thing right here is known as McGill forceps. Sometimes a paramedic will actually need to go in and look inside the patient's airway and will need to grab out certain things. Maybe if the patient was choking on a hamburger or something, he can go out and grab out some of that hamburger, grab out some of that food, some of that stuff that's blocking the patient's airway. So if a paramedic ever asks you to grab these McGill forceps, this is what they look like. They do come in adult and pediatric sizes, so obviously depending on your patient, go ahead and grab the correct ones. A couple other devices, really quick, really easy. Our stethoscope. Your paramedic should always be having your stethoscope, so I'm going to go ahead and put that on my neck. And we take a look at a couple other things. Number one, I'm going to go through this blue tube. This blue tube is kind of funny. It is actually known as a bougie, and it is a way for us to help insert an advanced airway on difficult patients. Everybody's airway is unique. They all have similar structures, but some of them are just more difficult than others. So this bougie is a way for us to go ahead and insert an advanced airway, but on a difficult patient. So this is a really good device. If your paramedic ever asks you for a bougie, this is what you're going to be handing to them. And then lastly, we have our laryngoscopes. Our laryngoscopes are used for any time we are actually inserting an ET tube. The ET tube, we actually need to visualize the vocal cords to make sure that we are actually inserting that tube into the correct place as we're going to go ahead and do that. So two different types of laryngoscopes. You can see that both of these are actually disposable. They lock out like this. They should have a light associated with it, so we can see down that patient's airways. But we have a flat blade, right, called a Miller, and they do come in different sizes as well. And we also have the curved blade called the Macintosh blade, or the Mac. That's the curved blade. Again, also has a light. We always make sure that light is working before we go ahead and use it. So we have our laryngoscopes. Hopefully they're ready to go. Your paramedic typically will either prefer maybe the curved blade or the flat blade. It really kind of depends on your paramedic and what they prefer and what they want to have. So I personally like the curved blade, so I'm going to go ahead and select that one for right now. Maybe I'd ask my EMT to grab that.